Hello everybody. Welcome back to my channel. Thank you so much for following me, MJ the Coding Coach. If I've been away for about a month, it's probably a little over a month now, but I've been away working on content for my website, which is going to be www.alliedhealthprepacademy.com. So I've been working on and creating content for my website because there are going to be self-paced online coding courses to help you prepare for the CPB, the CPC, and the CRC exams. So please be on the lookout. And of course, I'll give you updates as it nears for launching. So I've missed you guys just like you guys have missed me, but I've been away creating content for the website. So I am here on lunch. So I wanted to create a video while I was here on lunch since I hadn't saw you guys in a while. So today we're going to be talking about diabetes type 2, and it's so much information. You know, I love HCC coding. You guys know that's my favorite. So I'm coming from an HCC perspective, a disease interaction perspective, as far as showing you how diabetes type 2 affect other organs or other things, it leads to other conditions and diseases and symptoms. So we're going to talk about all of that today with diabetes type 2. I'm also going to break this video up. I'm going to break it up in several parts because the disease interaction, whether it's the kidneys, the heart, the circulatory system, being that you may have PVD with diabetes, the eyes, whatever it is, I'm going to break down those videos individually. So you have a video specifically talking about diabetes in your kidneys, or diabetes in your circulatory system, or diabetes in your eyes. So we'll have different segments for diabetes and the disease interactions that come along with diabetes. So what is diabetes? So diabetes is when you have too much sugar or glucose in your blood. You know, most of the food we eat, it involves or entails sugar. So it's when your body doesn't properly process or break down the sugar for you to use for your energy. So that's basically what type 2 diabetes is, and it's the most common type of diabetes that affects the way your body processes blood sugar. So type 1 diabetes is a chronic condition in which the pancreas produces little or no insulin at all. And then when you have prediabetes, that's when your blood sugar is elevated, it's high, but not high enough to say that you have diabetes type 2. So that's what diabetes is. If you're not sure, of course, Google, look up if you need more information so you can understand the series of these videos. So I also want to let you know an important guideline. If you're a new coder, if you're looking into coding, if you're a veteran coder, do not forget or always remember these things. If you're reading a medical chart, a patient encounter that a clinician has documented, if it does not specify the type of diabetes inside of the chart, you automatically assume that it's type 2 diabetes. Diabetes type 2 is the most common type of diabetes. Now, this is not per my mouth. I'm not telling you this. This is per the coding guidelines in your ICD-10 book. So, if the diabetes is not specified in the chart, if it says patient presents to the medical office to follow up on their diabetes, and it does not say whether it's type 1 or 2, you always assume that it's type 2 diabetes per the coding guidelines. Also, if you see someone has type 2 diabetes in the medical chart, always look at the list of medications that are presented. Medications are so important in regards to coding, especially HCC coding. So like I said, this video is about coding in general, but specifically toward disease interactions with diabetes and other issues in regards to HCC and risk adjustment. So if you see a patient has diabetes, if you are looking at the list of medications, if you see that this patient is currently on insulin, then you're going to always, not sometimes, not here and there, you're going to always use the code Z79.4. If the patient is on Novolog injectables or any kind of injectable insulin, along with you coding the code for diabetes or the codes, depending on how many you may need. Also, always code the code that reflects that this person is on insulin. Your Z code, which you know is your status code that shows the status of the patient's health condition. Excuse me. Also, if you see that the patient is on oral anti-diabetic drugs or oral hypoglycemic drugs, you're always going to use the code Z79.84 in addition to whatever diabetes condition that this patient might have. So I wanted to come first. I wanted to talk about diabetes. I wanted to give you the guideline where you always assume that it's diabetes type 2 if it's not listed. I wanted to let you know that you will always use your Z codes according to the medications listed. If it's injectable insulin, Z79.4. If it's an oral hypoglycemic or oral anti-diabetic medication, Z79.84. So Z79.4, Z79.84. So like I said, I wanted to do these videos in series so I can make sure that you guys get every intricate piece of diabetes and which organ that it's affected that we're going to talk about. So the next video is going to be about diabetes and how it affects your kidneys. And we're going to be talking about codes E1121, E1122, and E1129. So for the next video, make sure you have your books, or your ICD-10 book. You don't have to have books as in plural, but make sure you have your one book, your ICD-10 book. And if I can remember, it starts on page 533 in the 2021 edition of your ICD-10 book. So the next video, we're going to go into talking about diabetes and how it affects your kidneys, what code to use, how to code it, what not to use, and all of those different rules and guidelines when it comes to coding diabetes with other disease interaction. So I'm glad you came and joined me. I've been gone for a month creating content, working on big things. So in the meantime, make sure you're following my social media platforms. On Instagram, it's thecodingcoach_CPC. On Facebook, it's going to be Dynamic Medical Billing and Coding Group on Facebook. And of course, you're here on YouTube. Again, their website is www.alliedhealthprepacademy.com, and we're going to be launching soon. When we're launching soon, you're going to have access to know when workshops exist, tutoring, different coaching strategy plans. So all of the content will not be finished for you to start the self-paced course once the website is up, because as you know, creating content is not easy. I'm creating the content, I have to double check, make sure the answers are right, just get it copyrighted, all these type of things. So it is coming soon, but be on the lookout for that. And if you have any questions, make sure you drop your questions down below, or whatever. And thank you so much for joining me again for this video. And I will be making videos all day today talking about type 2 diabetes and the disease interactions. So thank you for joining me. If you have any questions, don't hesitate to drop your questions. Thank you.